Trust the science? Well, it sure seems like the science can't always be trusted. A new terrifying report from The Guardian indicates that research credibility is at an all-time low as a rash of fake papers made their way into the academy, into prestigious journals of medicine and other categories of science. According to The Guardian, tens of thousands of bogus research papers being published in journals in an international scandal is worsening every year. Scientists have warned medical research is being compromised, drug development hindered, and promising academic research jeopardized thanks to a global wave of sham science that is sweeping laboratories and universities. The concerns over the veracity of scientific inquiry come as a new study indicates that some concerns about vaccine-related injury may not have been all that far-fetched. Per Fox News, the largest COVID vaccine study to date by the Global Vaccine Data Network in New Zealand analyzed 99 million people who received COVID vaccinations across 8 countries. The study found that the vaccine was linked to a slight increase in neurological, blood, and heart-related medical conditions.
On the note of COVID-related maladies, new research into long COVID indicates that there may be a connection to brain damage and the disorder. Per Science Alert, analyzing 203 patients hospitalized with COVID-19 or its associated symptoms and comparing the results with 60 people without the infection, researchers noted elevated levels of 4 brain injury biomarkers, key signs of biological change in those infected with COVID-19. What's more, 2 of those signs of brain injury persisted into the recovery phase, suggesting that they continue even after the COVID-19 infection has gone. So there's, which I want to start at the top of this. Well, starting just with that last one, you know, when long COVID comes up on the show, there's often the critique that because of the nature of the symptoms, and as you point out, the population that disproportionately seems to be complaining about long COVID, it's easy to write it off as a kind of psychological issue where people are told that they have a problem and they have a kind of a psychosomatic response and that there isn't really a there. And what's interesting about this study is that because of that skepticism about long COVID, they specifically look for biomarkers, so like biological changes that are observable scientifically and recordable and measurable. And they have found a number of biomarkers associated with people who have been hospitalized with COVID, and more alarmingly, that at least some of those biomarkers persist after the virus has been cleared, suggesting that there could be long-term effects,
sure,
aka long COVID.
Particularly for people who were sick enough with COVID initially to be hospitalized. I think I don't have any doubt that if you're hospitalized with COVID, that there can be long-term damage, and it's important for scientists to evaluate what could be a potential, to look at potential treatments and cures and those sort of things for people who are still suffering these long-term effects. I don't doubt that, and we need to get more information about it. But the article we discussed at the top here is very worrisome indeed. It looks like a lot of, frankly, it was a problem in a lot of other countries, including China and India, where young doctors trying to make careers for themselves are coming up with fake papers. There's a whole industry of writing fake papers, paper mills, that are, again, just utterly false, that are not valid at all, not just like exaggerated, or you actually did the research and you reached the wrong conclusion, but are deliberately like made up, like, cheating on your research paper in college level fake, and being accepted by prestigious journals and then being treated as fact. There's not enough peer review, there's not enough skepticism. This problem has been well known, a slightly different problem in the social sciences, psychological sciences for a long time. We've heard talk about the reproducibility problem. It's so many papers. I think some estimates are as many as 50%, although that could be from a paper that's also fraudulent, but that a high number of papers on social science, behavioral observation papers that are accepted for publication, when they subsequently try to do a study to reproduce the same finding, they cannot reproduce the finding at all. And a lot of those make it through.
Yeah, it also makes me think of
But this is even more serious. This is the harder sciences.
Sure. I mean, it makes me think of the case that we talked about with respect to Vivek Ramaswamy, where the allegation is that he was able to make a lot of money off of his first business venture by basically finding an abandoned Alzheimer's drug. His mother is a doctor that specializes in geriatric disease, maybe geriatric oncology, I can't remember, but geriatric medicine. And she basically writes a paper that suggests some potential application and promise to the drug, which did not pan out, but that enabled Vivek to remarket it as the next big thing and basically do a sort of a pump and dump and make a lot of money off of selling this drug that had been abandoned because the research had demonstrated that it didn't actually have that much promise. So there's certainly a lot of manipulation that goes on in this industry, and there are some serious questions about how you can restore public trust in what is some legitimate science when there's so much illegitimacy out there, especially when, as many people were pointing out in light of the reporting about the vaccine effects, how suppressed any discourse around that was earlier in the arc of this pandemic.
Right.
At very least, allowing there to be some level of pushback and mooting and debate of these sorts of issues, I think, would engender more trust in what the scientists are saying, and that taking the exact opposite approach, I think, has led people to believe that all they can trust is themselves or what they see on their Facebook feed, sometimes to really bad effect.
Because the way skepticism was treated by governmental medical health authorities during the pandemic, I just think ended up being really counterproductive. You remember Fauci's famous, "I am the science," and "How dare you mistrust me?" You know, at a time where he was making claims about masks that have subsequently been, he made several different conflicting claims about those that did not pan out being true in terms of how totally satisfactory the lower quality masks were perfectly good. Remember early promises about how good the vaccines would hold up in terms of not just preventing severe disease and death and mitigating symptoms, but actually preventing the spread was a line that they clung to for a long time. The denial of infection-acquired immunity, saying that was no good. Even though it became obvious that people, once they had COVID, had some level of protection akin to the level of protection you get from the vaccine, frankly, and you weren't allowed to discuss that in polite company. And that's without getting into any of the origins of COVID stuff as well, which is that has fared the worst of all. People were demonized for having some rational skepticism. And that's been very damaging. Now we see from reports like this that there's every reason you can be too skeptical. You can reject absolutely everything because you just want to be contrarian or something. That's not healthy either. But you need to at least consider a variety of sources, explore which questions have legitimate and respected people on the other side saying, well, wait a minute about this, and that's how we get a more thoughtful and more informed public.
I mean, I also think that you need to have scientific literacy in the same way that some people talk about a crisis of journalism and fake news, and they think the answer is controlling what news is out there. No, I think that teaching people media literacy is really important. And I think that a lot of folks all across the political spectrum who've wanted to control the American mind over years understand how integral education and media literacy and scientific literacy is to being able to think for yourself and push back against authoritarianism. And I've worked overtime to limit people's access to education and getting those skills. And so I would also be very skeptical of anybody who wants to ban books, make it harder for people to go and get education, make it harder for people to access materials that help them understand these kind of journals and be able to assess them on their own merits, and to have more people from different kinds of backgrounds enter into research programs to be able to do the translation work of scientific journalism, which is incredibly important.
Well, that does it for us for today. Tomorrow on Rising, Briahna and I will be back to bring you the biggest news, and we can't wait to have another episode of our show. Maybe we'll do some rewatching of Heroes between now and then.
Oh, I'd like that. That's a good relief. Be sure to like, share, and subscribe so you never miss any content. And for those of you who like to listen while you're on the go, we're now available wherever you listen to podcasts.
Bye-bye.
Take care.